get started. So, good evening, everyone. Thanks for tuning in. I'm Sarah with the Purina Pro Plan, and we're excited to bring you a special presentation tonight with the OFA on using genetic health testing to reduce preventable health diseases. Our speaker tonight is the incredible Dr. Frances Smith, president of the OFA, board certified theriogenealogist, a dog breeder herself, and much more. Before we get started, I wanted to learn a little more about you, Dr. Smith. So, the first question I have for you is what made you pursue becoming a veterinarian?
Well, that's a really good question, Sarah. My parents actually bred German Shepherd dogs, and this occurred prior to OFA even beginning. My parents were very careful people. We had a lovely German Shepherd female, and they sought out experts in the breed, some people named Bob and Mary Kay Brockett, not the same as Lloyd Brackett, who wrote the genetics book, but Brockett's, who had a beautiful shepherd, and we bred our female. And my father said to me, a 10-year-old girl at that time, if you keep the kennel clean and take care of the puppies, you may pick a puppy to keep for yourself. Now, my dad was a Navy fighter pilot, and he was meticulous about everything he did. His idea of a clean kennel, we had a concrete floor and we had chain link, and you even scrubbed the chain link with a toothbrush to make sure it was spotless. So believe me, I earned that puppy. I picked a black and tan male whose name was Lance, and poor Lance had such severe hip dysplasia that at 4 months of age, he was unable to stand long enough to eat. So unfortunately, the decision was made by my father, our family veterinarian, and reluctantly by me that he needed to be euthanized. So I said, I'm going to grow up and be a veterinarian and do something about hip dysplasia so no more little girls have to kill their dog. So that's the story. So Lance is the reason. And I've come full circle now because I breed Labradors, but I do have a young male German Shepherd who is 18 months old, who certainly is not lame. So that's good.
Oh, I love that. All right. What would you say is your most memorable moment in dogs?
I would say the most memorable moment was a dog of mine whose name was Champion Danik Leap of Faith MH. That stands for Master Hunter. Bungee, because a bungee jump is a leap of faith, was a challenging dog to train. And I did that, and we had finished our master, and we needed just a couple points to finish his show championship. So my husband had taken him pheasant hunting the weekend before this show, where it looked like the competition was such and the judges were such that there were hopes that he would win. And he had gone through a barbed wire fence and cut the top of his head and had a big long bald strip.
Oh, no.
But in fact, the judge said as he came up to him, he said, so what happened to him? I said, it's an honest pheasant hunting wound. And he said, and you will be winner's dog. So that was very memorable, and that finished his championship. So good for a judge for not penalizing an honorable work injury. He didn't have a bandage on it, which wouldn't have been involved, and it wasn't bleeding, but it was it was a wound.
Nice. All right. So, outside of dogs, what hobbies do you enjoy?
I love to garden. I ride horses. I like to read. I quilt on occasion. I do it poorly, but I enjoy it. And I like movies. I have two
Oh,
granddaughters who are now grown. I'm anxiously looking forward to the granddaughters producing some great grandkids, but I don't know how soon that will be in the future.
awesome. Thank you, Dr. Smith. We're so excited to get started. If I can get you go to the next slide, please.
All right. So, is this the
Uh,
slide you want, Sarah? Yes?
yes, perfect. All
Okay.
right. So we are aiming for about an hour and a half, maybe a little over, depending on how many questions we get. Just a little bit about myself. I'm Sarah Manzi on the ProPlan breeder team. I am a second generation dog breeder of Portuguese water dogs and Lagotto Romagnolo. I have handled many breeds other than my own, and I've recently started getting into judging, having judged both of my breeds' national specialty sweepstakes. But enough about me. We're going to get into some general housekeeping for our webinar. So we're a big group today, so everybody's going to be on mute during the presentation. But do put your questions in the Q&A box and just take a minute to look at the difference between the Q&A and the chat. All of our questions are going to be coming from the Q&A box. Ask them as we go on the topics, because I'm going to be jumping in today to ask Dr. Smith your questions as we go. If we have time, we're also going to be doing a short Q&A at the end after our sponsor message. We just ask that you keep your questions to the topics covered today, and then note the difference between the Q&A and the chat. Next slide, please, Dr. Fran. All right, health testing topic is very timely for us at ProPlan because we have a new Platinum Rewards tier in our Pro Club breeder program, where we're partnering with breeders who do the breed testing recommended by their breed club. And what we're offering is a $70 credit to the breeder to spend on their future ProPlan purchases for every new puppy owner they refer to ProPlan who goes on to buy just one bag. I'll circle back to this at the end of Dr. Smith's presentation for a few more slides on Pro Club Platinum. And now over to Dr. Smith.
All right. So thank you very much for inviting me. I think you'll enjoy this presentation very much. These slides are very much the courtesy of the OFA. Some of them are my originals, but most are not. So as Sarah said, I'm a diplomate of the American College of Theriogenology. For those of you who don't know what it is a combination of human, OBGYN, and urology. I like to say I deal with the nether parts and the inner parts. So very important to making sure we have dogs for the rest of us to go on with. I also like to point out that there is a difference between being a specialist and not. We have many talented veterinarians in veterinary medicine who are interested and have extra expertise in topics. But in order to be considered a specialist, the American Veterinary Medical Association, you are only a specialist if you have board status with whatever board you are involved in. So if you're a surgeon, you can be a board certified surgeon. I'm a board certified theriogenologist, which is different from someone who is a member of what is called the Society for Theriogenology, which is a reproduction group that does not require board participation. So who I am, I'm board certified in small animal practice. I actually retired theoretically in March of 22. I'm every bit as busy now as I was when I was working full time. I'm a breeder, owner, trainer, handler, and judge of retriever breeds. I also judge lots of other sweepstakes in terriers, toys, and working dogs. I'm the president of the Labrador Club, Inc. in the United States. And for all of the Canadian Labrador people there, our national specialty will be held in October at Purina Farms. Come and see us, and one of your own Canadians is our judge. So that would be lots of fun. Mike Linktoe, and I'm sure he would be happy to see Canadian Labrador people there too. I'm also the health chairperson for the Labrador Retriever Club. And what that means is when someone contacts the Labrador Club with a health concern that they've had in their own dogs or to get information about different breeds, the email or whatever gets passed on to me. I'm also the president of the Orthopedic Foundation for Animals, and I've been on the OFA board for a very long time. So this talk is responsible dog breeding using health screening. So I want you all to look at this picture. I have a dog in my yard now who doesn't look exactly like that, but she's a dog that found us. I now live in Mississippi, and we tell our friends that we have a rare Mississippi street dog, but she was truly a feral puppy that showed up at our house. But while this picture is important, there's two things. Number one, the author of this article, Wayne Reiser, DVM, was one of the first veterinarians to become heavily involved in orthopedic disease and genetics and the correlation between how dogs were built and how orthopedically sound they were. If you look at this dog, and this dog looks a lot like dogs you'll see on the Caribbean in the street dogs in Africa, pretty much street dogs everywhere. The unique thing about this dog is it has erect ears, a longer rather than short muzzle, moderate coat length, and it's a pretty rangy dog, meaning it has more length of leg than depth of body, which allows for speed and agility. So this is in nature the biologically most sound dog. Why is that important? When we breed dogs, we deliberately select for different traits, and oftentimes those are away from this street dog, or as it's sometimes called, the pariah dog. So throughout history and following dogs being domesticated, we have shaped dogs to the size, shape, behavior, and temperament through selective breeding. And the dog is, in fact, the most genetically engineered species on the planet. There's way more difference between the breeds of dogs than there are between horses, between cattle, between chickens. We have huge extremes, huge shape differences, just tremendously different genetics. So dogs are selected and were selected by man for form and function. Early on, as dogs became around the Neanderthals, et cetera, they hung around the caves where they ate the trash and the leftovers. They also alerted the people that somebody else was out there. And depending upon the needs of the people in the area, the dogs that were allowed to stay were selected from that group. So in this picture, you can see all of the sports that or events that dogs are involved in: sheep herding, the shepherd guarding, the flock guard. That happens to be a kuvaz, maybe not the prettiest one, but it is a kuvaz. Beagles and bassets go into earth, and of course the retrievers retrieving birds. Same thing is true when people choose cars. If you're going to be going to hunt tests and field trials, you're not going to pick that Mini Cooper because it's not going to do very well off-road. It's a fun car to drive and zip it around on the highway, but form and function is not for that. I'm fortunate in that I have both a fun car and work cars because of the different things that I do. But when you take a number of dogs to dog shows and you compete or to hunt tests and trials, you need a big truck with a big dog box on it, and that little Cooper is not going to cut it. The concession is it can still be red, which is my favorite automobile color. So why do people purposely breed dogs? The major reason is, what do you get with a purebred that you don't get with a non-purebred? It's predictability. You get predictability in appearance. A beautiful English setter here, that's a field-bred English setter as opposed to one of our conformation breds. That's a blue Belton dog, a and so you know that if you get an English setter, you're going to have some weathering and feathering and some coat, which means if you're hunting where there's a lot of birds, you're going to do a lot of brushing. Size. We have size from the great big Irish Wolfhound to the little tiny Chihuahua. They have the same genes, there's different gene expression, but huge genetic diversity. I think I missed one there. Temperament. The dog's very similar. You cannot predict that a Labrador is going to be much of a guard dog. That Labradors actually will protect people if push comes to shove, but will not protect property. In fact, you're likely, if a burglar gets in and you're not home, to show them where the good stuff is kept. So breeders then are the custodians of their breeds in the gene pool. So it's the ethical responsibility of all breeders to use all the available tools to produce healthy dogs. So let's talk about what's a breeder. I have people call me who say, well, I'm not really a breeder, but I've had 4 litters. Oh, yes, you are. The dictionary definition is simply someone who breeds dogs. In the state of Minnesota, Minnesota says you are a dog breeder is if you are the owner of the mother of a litter of puppies. You talk about simplistic, that's it. Whether deliberate or not, you own the mom and it has babies, you are a breeder. So the breeder may be a purebred breed, a mixed breed, and it may be purposeful or accidental. the great majority of the dogs born in the United States still are the result of accidental breeding. And I bring that up because we hear a lot about responsible breeding. Yes, we as guardians and fanciers do a good job. We might have an occasional accidental breeding, it's not common, but our breedings are typically deliberate. And the problems with dogs that are unwanted and unhomed are the result of these accidental or failure to breed. Who breeds, what motivates them, and how educated? Again, most of them are accidental. The statistics that I most recently read said over 70% of the dogs born in the US were unplanned breedings. Then we have the casual backyard breeding. I would see those people in my clinic and they would have a dog that they were very attached to. And they would say, I think I'm going to breed Taffy because she's just a wonderful Cocker Spaniel, so she really should have puppies. And I couldn't stand it if I didn't have Taffy. So my response to that always was, when you are considering breeding a female, there are a number of things you really need to think of. And if you could not live with yourself if Taffy died during pregnancy or delivery, you definitely should not breed her. And in fact, you should make an appointment to have her spayed. Pregnancy in the bitch and pregnancy in any mammal affects numerous body systems, all of which increase the risk of death. Now, do most dogs die giving birth? No. Do most humans die giving birth? No. But there is increased risk to your immune system, to your respiratory system, to the coagulation system. So there are always increased risks with the breeding. So that's the first thing I say. Then I say, are you prepared that when you have these puppies, that if you can't find homes for them, you'll keep them all? And if not, you shouldn't do it. And realize once puppies get up on their feet and are moving around, they're both smelly and messy and they're a lot of work. In my contract, I will take back any dog that I've bred for any reason at any age, and that is the responsible way to handle your breedings. If you can't do that, if you live in, for instance, near where I lived in Apple Valley, Minnesota, they had dog rules that said you could only have 3 dogs over the age of 8 weeks. Okay, so you had a golden retriever and she had 12 puppies, and you only have 2 sold. What are you going to do with those extra puppies when by law they have to be out of your house? So with the casual backyard people, they typically have done no health testing. Usually it's convenience that helps them decide who they're going to breed to. Motivation is either they think it will be educational or they think they're going to make money. One of my first jobs that I had as a new graduate veterinarian was at a humane society. And I will tell you, it was profoundly depressing because my job was, they did not have a full-time shelter veterinarian. They only hired veterinarians to come in to do euthanasias because legally only veterinarians could administer the drug that causes the death of the dogs. It was very common during that job on a weekend that I would have a 55-gallon drum full of deceased animals. So again, I would say to the clients, this is your responsibility from birth through death. Are you ready to do that? People think it'll be just fun if they were going to breed a litter of puppies, but it's a huge amount of work. Next, we have the commercial or high volume breeders. And I want to address that because I want you to know that while I am not a fan of, I'm going to say dogs as a business, commercial high volume breeders can do things very, very well. And I hate the term puppy mill. A puppy mill to me is somebody, whether they have 1 dog or 100 dogs, who does not care for it, enhance its life, enrich its life, and enjoy the dog all of its lifetime. So if you are a person that has a fabulous setup, lots of help, lots of money, and lots of time. Theoretically, you could do a great job if you have 50 breeding bitches. In my practice in Minnesota, I did not have high volume breeders, but I have breeders that had a number of litters per year. And I would have the occasional person who only had one litter a year. And they were the one who was actually guilty of being the puppy mill. That one litter was their money bag for the year, and the dogs of themselves were not important. And I think that's sad. What most of us are, though, is this last category, purposeful hobby breeders, ideally motivated by passion for breed, thoughtful selection, and a desire to achieve quality. All hobby breeders don't do a great job, but many of them do. And I would say most of us, like me, I would say dogs are my obsession. So maybe a little over the hobby edge because dogs are me. So to breed or not to breed, the responsible breeding practices are many. You need proper care, proper feeding and housing. You need to screen prospective homes. And it's a lifelong commitment. It's a lot of work. Vaccinations, worming, shelter, et cetera, et cetera. So with that decision, you need proper socialization, lifelong commitment. One of the things, again, that I try to do with my puppies, they are started on Pro Plan, their mother's Pro Plan, as soon as they barely start to get teeth. Usually for the Labrador puppies, that's about 15 days. I offer it soaked, kind of like slurry. I put it in the blender. The hungry puppies eat it right away. The ones that aren't hungry take a couple more days. And then I gradually decrease the amount until by the time they're ready for weaning, they're eating dry Purina Pro Plan 30/20, which is the food that I feed throughout life. I feed it from infanthood to geriatric ages. They are carefully socialized. They're raised right in our house, right off the kitchen. They get loud music. They get TV. They get to watch the Shark Zumba, the little robot vacuum cleaner, which is a fun thing to see puppies interact with. Some think they're going to just chase it. Others are afraid and get used to it. They need all of those lives. The other thing that I make a real effort to do that I think makes dogs' lives much better, I make sure that every puppy has been on at least 7 surfaces by the time it goes home. Gives them great confidence in all kinds of environments. But those are the kind of traits, the socialization, the feeding. Feeding like that's a lot of work. Housing them, a commitment. Those are what differentiate those of us who are responsible from accidental, casual, one-time breeders and commercial operations. More than 25 years ago, AKC did a poll of some sort to people who had bred a litter to see if they were ever going to breed another litter or not. And greater than 70% said they would never have another litter of puppies because it was so much work. So us, we're wrong. We're different. We like having all that work. So what's the most important concern of people when they purchase a puppy? Not just a purebred puppy, any puppy. And it's health. I love this little ad. I mean, it's really, really cute. That's a cute little chihuahua. Oh, absolutely. So beyond health, health is way beyond providing puppies with shots, worming, making sure they're gaining weight. No one wants to produce dogs that are blind, lame, or seized, or puppies that have heart issues, or skin issues, or any other defect of any kind. But the actions that we take in deciding who we breed can minimize inherited disease, and those are the defining characteristic of serious, dedicated, responsible breeders. So I'm going to give you this next statement is my own personal statement. It's not an OFA statement. It's not a Purina statement. It's not any of that. I, in my experience, so again, I am owning this, do believe that most dog breeders are very honest. That being said, I will tell you that if you fail to ask a question of a breeder, particularly when it comes to health or temperament, it is often interpreted by the person being asked that that is not important to you, so they do not volunteer information. So I'm going to give you a specific example. A number of years ago in the Labrador Retriever breed, we were having some issues with seizures. And there was a stud dog that I wanted to breed to. Now, I know we're talking about OFA and health testing, and it does fit in. I wanted to know if that dog had seizures or not. So I called the stud dog owner and I said, does he have a history of seizures? The owner said no. However, in that litter of puppies, I ended up with some dogs with seizures. So when I talked to the stud dog owner again, that I said, asked the same question, and the answer was no, he doesn't have seizures because he's on phenobarbital. So I hope you all caught the gist of that. Not truly a lie, an omission. So don't be afraid to ask the breeder heavy questions. And if they're reluctant to answer, be warned. Okay. I love this poster. I don't know about Canada and their anti-dog laws, but we fight continually in this country so that locales don't come up with ridiculous dog laws about spaying, neutering, different breeds, et cetera, et cetera. So be aware and be aware of the legislators that are on your side and our side. Most all of them, again, are good if they're educated and are educated by responsible people. We don't want the law taking away our right to own dogs. So what role do you play? Veterinarians are a big source of information to the breeder and can influence your decision to breed dogs at all and to breed dogs ethically. I will also tell you here, as an OFA person and a breeder myself, if I radiographed a dog and its hips were abnormal and the client would say, should I breed it or not? I would say, my job is to educate you, and it is your job to make the decision. If you are asking me what I would do, I would not breed a dog with bad hips. Now, we're going to talk about some other scenarios too. But again, we have a lot of influence as breeders to what people will do, and your veterinarian will help you with that. Selection criteria for breeding dogs should be conformation traits like type and soundness, temperament, pedigrees, working ability, and health is a big one. Temperament is very heritable. It has a genetic basis, just like hips, etc. Working ability is heritable, but not as we would like it to be. So the OFA is a not-for-profit organization. We're organized as a 501c3. We were established in 1966. And the gentleman who started the OFA was John Olin. John Olin was a sportsman and a philanthropist, very dedicated to Labrador retrievers and some of the pointing breeds. And he was concerned that some of these dogs became lame as they aged, and he wanted to see what could be done to prevent that. So he provided the initial funding for the OFA, and the OFA was originally physically started on the grounds of the University of Missouri in Columbia, Missouri. The OFA objectives are to collate and disseminate information concerning orthopedic and genetic disease of animals. Realize when we started, we didn't have any genetic tests. We only had phenotypic tests. To advance and advise on programs to lower the incidence of orthopedic and genetic disease. To encourage and finance research in orthopedic and genetic disease. and the OFA has funded over $5 million in grants, receive funds, and to make grants to carry out these objectives. The OFA objectives are met through our core service, which is board-certified radiologists who look at radiographs looking at hips, elbows, leg cath-perfes, and shoulder OCD. We have an OFA. Oh, I don't know how that happened. I didn't touch it. I'll go back. The OFA database and website provide a tool for breeders to make more informed breeding decisions. And we're going to talk quite a bit about vertical pedigree use and how that can help. And as I say, we read grants and we fund grants. All of our grant funding is basically done through the Canine Health Foundation. So the Orthopedic Foundation for Animals, it is a voluntary diagnostic service. When I lecture to vet students, they're wonderful young people and they have very lofty ideals and they want to know why we can't make people do all these health tests. We can't because we're a free country. We can educate and we can encourage, but the diagnostic service is voluntary. The OFA is also a data bank for genetic health status for dogs and cats, and it is the world's largest animal health database containing genetic information. For those of you who are cat people as well, you might be interested to know that the Maine Coon cat has a high incidence of hip dysplasia. And I just learned this last weekend when I was in California lecturing that there was a reptile specialist there, that iguanas have a high incidence of hip dysplasia. So there's a little trivia note for you. Today's mission for the OFA is to improve the health and well-being of companion animals through a reduction in the incidence of genetic disease. The OFA databases include all of these and more: hip dysplasia, elbow dysplasia, patellar luxation, also known as slip stifles, leg cath-perfes, congenital cardiac disease, thyroid, congenital deafness, sebaceous adenitis, and shoulder OCD. Diagnosis of all of these diseases is based on phenotype. And phenotype is what you see. You see the picture of the hips, you see the elbows, you attest for the deafness, and it measures that the dog is deaf. With sebaceous adenitis, tissue is examined looking for the changes there. So it's something that is actually seen. Then we also have DNA databases for genetic disease. These are primarily diseases that are inherited as recessive traits, which means the dog gets one gene from each parent for these diseases if they are going to be affected. An important disease in Labradors is exercise-induced collapse. I won't give you a test at the end of this, but that is actually a defect in a gene called dynamin-1. So dogs with two copies of this defective gene under situations of excitement get wobbly in the rear and collapse. And it was very common in the breed, but we do have a test for it now, and it is inherited as a recessive. So you can breed around it and still not have to discard really, really nice dogs. This is
Dr. Fran,
yes.
I'm just going to jump in because we've got our first question here about patellas.
Sure.
So we've got Sarah here who says, I have two OFA clear purebred poodles. I just found out one of my 6-month breeding offspring females I kept back as a grade 2 patella. Could this be from an environmental factor, or is it possible it came from parents that have been tested clear?
Okay, that's a very good question. The likelihood patellar luxation is inherited in a form called polygenetics. So it's based on dose of genes and numbers of genes. Odds are very high that this is genetic in nature and not environmental. And actually, one of the things that causes patellas to luxate, the patella is the kneecap. There's really nothing wrong with the knee. What happens when the dog bends its leg, the kneecap does not stay in the normal position. And usually in small dogs like poodles, it goes to the inside, which is called medial patellar luxation. In larger dogs, and one of the breeds it's more common in, believe it or not, is the flat coat. It tends to go to the outside, and that's lateral patellar luxation. The commonality in these is that disease is diagnosed based on palpation, meaning the veterinarians move the joint and they can feel the kneecap slip. If you radiograph those dogs, take an x-ray, you will see that they tend to have more of a curve to either their femur, which is the big bone in the hind leg, the upper bone, or to the bones lower than the knee, so that the patella stays where it is, but the bones, it allows the patella to slide out of position. It really takes quite a trauma to have a dog luxated patella if there is no genetic component. And if you have kept that dog back, you would have known. For instance, a dog that has normal patellas, their patella will stay normal even if they jump on and off the couch or off the tailgate of your car, et cetera, et cetera. And what likely is happening there, it's likely that siblings of the parents also, somewhere in that parentage or grandparents even had problems with patella. That's a really good question. So even normals, when it's based on a phenotypic test, you can get abnormal.
All right. We've had a couple more come in as well.
Sure. Okay.
Of which genetic lab would you recommend using for testing?
All of the labs that I am aware of, their tests are accurate. So it boils down to whether you're going to do individual tests or some of the panels. And my problem with the panels is from the standpoint of production and cost, and this is not wrong, it's just a fact. It is more cost effective for a company to run a big panel, let's say that maybe has 100 tests on it, than to run a test for somebody with 5 tests on it, because you have to use the same mechanism, the same materials, et cetera, et cetera. So many labs in the panel tests include tests for diseases that are either of no importance in your breed or may not ever have been even identified in your breed. But the good news is, to the best of my knowledge, all of our testing labs now do a good job. There are differences in cost and turnaround time, of course.
Perfect. Good to know. We've also got some food questions, which we're gonna put in
Sure,
the general Q&A at the end, if you're okay with that, Dr.
sure,
Fran. But
sure.
there's another one from for heart eyes, multiple tests are published. This seems different for hips and elbows. So if someone submits multiple hip or elbow x-rays, having checked the publish in any case box, why are the previous results removed? For example, if the first elbows didn't pass with the box checked, the second x-rays did pass, the first results are no longer visible.
So the way when films are, I think it's a complicated question and a complicated answer. When OFA radiographs arrive at OFA, first of all, they're screened to make sure the identification, the owner's name, the dog's name, et cetera, is all there. They're then also screened for proper positioning. If the positioning and all that other stuff is met, then the owner's name and the breed, everything is blinded, so that the only thing the radiologist sees is the breed of dog and the age of the dog and the sex of the dog. Okay. And so then independently, those radiographs are read. But when you submit films to OFA, you sign a form that says if the results are normal, they will be posted. The owner of the dog also has the option to post abnormal results. And that's a good thing to do. No one wants abnormal results, but I will tell you, I've produced some dogs that weren't normal. I put that information in the database as well because it helps others in making breeding decisions. Now, it's if the first time I have not seen a case like the person described where the first time they didn't pass that they were published. The only person who would have seen that is the owner of the dog itself. If positioning is an issue and the dog is radiographed again and the positioning is proper, I have seen it where the diagnostic result changes, meaning if you have the pelvis tipped too much or if you have the elbow flexed in the wrong way, you can get false negatives or false positives. So you can resubmit films and they will be evaluated. However, we do have a system in place at OFA to prevent cheating. And I can't give you all the details on it, but I can summarize it because it's pretty clever. So we're going to pretend Sarah's being a naughty girl and she is sending, it'll have to be a Portuguese water dog to the vet clinic to have OFA hip x-rays. And she's going to send John, her husband. I don't know if Sarah even has a husband, but right now she has John. So John comes in with Porky the Portuguese, and they radiograph Porky, and Porky's hips do not pass. A month later, Sarah comes in with Porky and is radiographed. And this time, Porky's hips look really good. So what will happen at OFA then is Sarah will get a call from OFA and say, "Dear Sarah, is it possible that your husband John can't tell the dogs apart? And that when Porky was x-rayed the first time, it wasn't really Porky?" In the case of fraud, which some people do try to do, almost always the people back off and say, "Oh, we must have made a mistake," and that ends it. If it does not end it, there are further steps that are taken and the fraud is reported. First of all, you lose your OFA privileges, but it's reported to AKC and you lose your AKC privileges. So we do have a mechanism that we can catch the fakers. I think that if there's further questions on that, I'll go further, but I think that probably helps.
I will say that's funny. My husband's name is Sean, so it also rhymes. And
Oh,
occasionally he does ask me, what dog is that? Uh,
fun. So
all
we
right,
have, go ahead.
I'll let you jump back into your presentation and then I'll stop you in a bit for the next couple
Okay.
questions.
There are 21 board certified radiologists that read radiographs for the OFA. So again, on a dog of age, meaning of 24 months or all 3 radiologists return their results to OFA and you get a consensus reading. So I'm going to give you an example. If 2 of the radiologists say a dog is an OFA excellent and one says it's a fair, the dog gets an excellent. How about if it's 2 say it's excellent and 1 say it's borderline? In that case, the films are recycled and they go to 3 different radiologists. We do have a quality control system to make sure that our radiologists are fair and consistent and neither too easy or too hard. And say, for instance, if we had a newer radiologist and no dogs were passing, that radiologist would probably be asked either to take some more training or maybe not to read for us. So we do try to be fair and consistent. Each year, the OFA also reads over 2,500 cases for service dog organizations at no charge. A lot of these are guide dogs or canine companions for independence, etc. You ready for the next slide?
All right. So we have a couple more.
Okay, that's fine.
Some good questions.
Good.
Carol asks, within our club membership discussion, it was mentioned that thyroid is not as accurate as we have been led to believe. Is it possible that passing scores can vary between breeds? There's been suggestions that bitches be also tested during gestation. Breed in question, Rhodesian Ridgeback.
Okay. So the thyroid database, I'm going to give you a little background on it, how the testing protocols are developed. OFA does not develop the protocols. So the thyroid protocol came from the American College of Veterinary Internal Medicine, their endocrinology group. They were the group who together set the standards and said that the dog had to have certain values of T4, T3, thyroid stimulating hormone, thyroglobulin, autoantibodies. So that group set the standards. In answer to your question, is it possible there are breed differences? Yes. And there have been some recent research done at Michigan State that OFA participated in that indicates that there is some concern that maybe the test for thyroglobulin autoantibodies is accurate, but that it may not have been interpreted as ideally as possible. And we do know that vaccines and heat can certainly interfere with thyroid values. So retesting should always be done when a bitch is not in season and not within, I can't remember the exact time frame, but I think it's 30 days of a vaccine.
You still hear me? My headphones just died out on me.
I didn't hear that. I'm sorry.
Can you hear me?
Now I can.
Oh, sorry about that. My headphones just died out on me. All
Oh,
right.
okay.
So the next question is, are you familiar with work being done in the UK and Scandinavian countries, decreasing the incidence of IVDD in dachshunds involving spine x-rays between age 2 and 4 to determine the number of calcified discs? Dogs
Yes.
with 5 or more calcified discs are not recommended for breeding. Does OFA have a similar program or intent to?
Okay. I'm familiar with it because I was at that program in Scandinavia and I saw that poster, et cetera, et cetera. It is very interesting. I think it has some promise. OFA does not have that program planned, nor has there been any request here to have it. And I believe the reason for that is there wasn't a large enough population to convince some of the researchers here that it was going to be statistically viable. But I think it is certainly something worthwhile keeping track of and considering for the future.
Perfect. And then will you see different results with radiographs performed by different vets, i.e. using the vet using a special chair versus traditional ways?
A special chair.
I think maybe like hip x-rays when vets use the trough versus when they're just on the table, I'm guessing.
Okay. So positioning is very important. And my recommendation there is when you decide who to go to get your OFA hip films taken, either ask people that you know in your area or call the vet themselves and ask how often they take them. If you can't get those answers, you can call OFA and they won't recommend a veterinarian, but they can give you the name of veterinarians in your area who take a lot of OFA films. That's going to be your best bet for getting the best positioning. So yes, and another question that comes up, sedation or not, In a perfect world, OFA would only read films on dogs that are sedated. We do not require sedation because our lawyers sedated every dog for OFA. You get much better films and the dog is much more relaxed.
Perfect. All right. One more and then we'll get back into your presentation because
Okay.
I know some of these go towards what you're about to talk about. I'm
Okay.
testing I'm testing a 22-month-old's hips. She's a small breed. I
Mhm.
understand that this will be considered preliminary. Is there a high
Yeah.
chance of something changing in the next 2 months?
Okay. So, well, it's interesting. Sarah and I kind of talked about this before. When it comes to hips, depending upon the breed, we have very good statistics at OFA on the reliability of prelims, but they are still, and I stress this, prelims. And an example that I'm going to give you is two retriever breeds. If you have a Labrador Retriever puppy, young dog, and it gets an OFA good, and it is over 6 months old, it has about a 92% chance of having normal hips at 24 months. Might not be a good, might be a fair, but pass it. On the other hand, if you have a Chesapeake Bay Retriever and it has normal hips at 6 months, it only has about a 65% chance of still being normal at age 2. In toy breeds or smaller breeds, the closer you are to 24 months, the likelihood is that you'll be good. But we do have statistics on many, many breeds for how reliable. But they are still called prelims because in the absolute scientific studies, we're looking for a 95% certainty that the rating that we give you is real. And prior to 24 months, you could not reliably get 95%. So hopefully that helps.
Perfect. Thanks. All right. I'll stop you in a little bit.
Okay, sounds good.
All right.
Okay. So in our database, we have almost 2 million dogs with hip records. There are 802,000 dogs with elbow records in the database, and almost 796,000 dogs with eye records in the database. Eye records are based on both phenotype and genotype. And the reason for that is when you have your eye exam by the ophthalmologist, that is a phenotypic exam. And he will tell you that the eyes are normal or the dog might have a cataract. The genotypic eye tests are typically for things like PRA or some other genetically inherited eye test. So the eye records are very, very different. So here's some examples of hips. And these are really good films. I asked for these from OFA. I don't think I have a point. Anyway, the dog with the R that you can see in the film has beautiful hips. That dog got an OFA excellent. Important things to see on positioning are these. Can you see my arrow when I do this? Can you
Yep,
see it?
we can see it.
Okay. All right. Those are the foramen. Notice those foramen are exactly the same shape, and the spine is absolutely straight. And this one too, where the dog's hips are not normal, also the foramen, it's a different dog, and it's not a normal dog. So let's look at these. What did I do? Let's see. Why doesn't it want to advance? There. Oh, that's elbow. There. Okay. Now you can see the black line. What is different on the normal dog versus the abnormal dog? The black line is the backside of the acetabulum. And so it shows how far that hip is into the socket. And on this dog, you only have a little bit. And in this one, it's right tight up against the inside of the socket. So that's the difference between being normal and abnormal there. And then elbows, which are far more complex, I believe. You commonly get changes along the ulnar groove, changes here in the coronoid area, and arthritis along this joint right here. Typically, elbows, and I told Sarah this previously, I sweat elbows every time I radiograph one of my dogs because I've seen Labradors that have normal elbows at 23 months that aren't normal at 24 months. Once you get to 24 months, you're in really, really, really good shape. And the bad thing also for elbows for me is that if you were to look at a dog who is lame, a dog that has bad elbows is likely to be more clinically lame than a dog with bad hips. I want to send you all to the OFA website, a complete source of all kinds of information on finding dogs. So realize, let's just say my kennel name is Danik, D-A-N-I-K-K. Any of you can go into the OFA database, type in Danik, and it will bring up all of the dogs' names of mine in the database with their registration number and all of their clearances, or in the case of the ones who are not clear, it'll tell you what they weren't clear of. It will not give you owner information because that is a violation of privacy. But because the owner signs the information that says you can use this information to share with the public, you can get tons of information on a breeder and how successful they are and what kind of clearances they are getting. So this was my pug. He lived to be 11 and a half, and I'll tell you, he could run right with the Labradors. Didn't swim, though. He was a mudder. So to manage our genetic disease, what are we going to do to get genetically healthy offspring? You need to screen the parents and breed healthy parents. You cannot control all genetic disease. However, we have the knowledge and tools to improve the genetic health of puppies. And genetic disease accounts for 25% of all canine disease processes. It's as frequently diagnosed in crossbred dogs as in purebred dogs. And I want to tell you, in Minnesota, while I personally do not crossbreed, I had a client who deliberately bred golden doodles, and they did it well. And they came and asked for help on information of how to do it. They started with genetically sound golden and a genetically sound poodle, and they selected for that. And I said, and you need to do all of the health tests for both breeds. And these people did a fabulous job of producing exactly what they wanted in the size they wanted, with healthy hips, healthy joints, and healthy dogs by doing genetic testing. Again, as I say, you can do the same thing in crossbred dogs. But it is a misstatement or a misbelief that if you cross two dogs, you decrease the risk of the genetic disease. You do not. So to manage genetic disease, you need to know how it's inherited, what tests are available, both genotypic and phenotypic, how prevalent it is, how severe is the disease, and breed pool size and diversity. So I'm going to use the Labrador Retriever again as an example. Labrador Retrievers have a form of inherited eye disease called the PRCD form of PRA. It results in blindness in dogs over age 7, okay? We have a genetic test for it, so you can prevent it from happening. But yet, if you were to ask me, is that as serious a disease as, let's just say, as elbow dysplasia? In my opinion, as a veterinarian, a dog, it is not. And the reason is a dog with elbow dysplasia always hurts. You can help them with medication and sometimes with surgery. A dog that gradually goes blind with PRA is not in pain, typically has memorized the whole house, and everywhere it goes can jump in and out of the car, and is a happy camper. So if I had to choose, and I don't have to choose because I do all the testing, I would pick a dog that might develop PRA in old age to a dog that can hardly move due to the pain in its elbow. So there we're talking about severity of the disease. Yes, you're blind, but there's no pain or really major hampering that occurs in a dog with PRA. The other thing that can happen, there are genetic sports where all of a sudden from nowhere a dog will have a very unusual disease. That doesn't mean your whole breed has it, and it doesn't mean you need to go off the deep end and rehome all of your breeding stock because it occurs. So genetic tests need to be used thoughtfully. I have on here breed pool size and diversity. Again, using the Labrador, the most popular breed in the US for over 20 years, I would not breed to a Labrador who is an OFA fair. And why would I not? Because we have thousands and thousands of dogs with great pedigrees that have better hips than that. Now, if it were a different breed, an OFA fair might be very, very desirable. And if it's a breed like the pug, if they get an OFA fair, they celebrate it. Those dogs do not, as a breed, have good hips. Fortunately, clinically, they don't have a lot of problems, but for them, an OFA fair is a real achievement. So you have to know also about these diseases. Is there a way to screen? Not always. We don't really have any predictor tests for bloater epilepsy or something that happens with dogs that are over 12. I don't get very excited when the OFA gets a grant proposal and somebody wants to research something that occurs in dogs that are over age 11. Yes, it's important for those dogs, but we need to take more care of the dogs that are younger that have their whole, again, my opinion, lives ahead of them. So, phenotypic tests, and we talked about this, it identifies dogs that are normal or abnormal, but we don't know the genetic cause for all of these. Hip dysplasia, elbow dysplasia, congenital cardiac disease. So those would be diseases like subaortic stenosis, which golden retrievers get, tricuspid valve disease, which Labradors get. We just don't have the genetic cause for that, so we base it on listening to the heart, and if the heart is clear, they're clear of congenital cardiac disease. Patellar luxation, autoimmune thyroiditis. Genotypic tests, we actually
I'm going to jump in there because we've got a lot of phenotypic tests questions in here that are great.
Okay.
So the first one is Debbie says, I feel pen hip is a better test for future hip soundness than OFA x-rays. Plus, it can be done at 16 weeks rather than waiting till 2. Is OFA considering adding pen hip results to their database?
Pen hip will register put pen hip results in the database. But two things that you need to know. OFA will read hip films on dogs over 16 weeks of age. So it's a fallacy that pen hip does not. And pen hip really doesn't have vertical pedigrees so that you can track whether that's really true. It's based purely on laxity, and they do not have a similar system for elbows. So it's a good system. My biggest objection, really only objection to pen hip is only the owner and pen hip has the data. It's not published anywhere. So it doesn't help the breeder trying to figure out where to go and what dogs are kind of producing what.
And I will put in there, because I did this with another dog, if you want to put it in the OFA database, your dog has to already have another test in the database before they'll add it in.
Yes,
I just learned that.
Yeah, absolutely. Yes, you have to pay to put it in.
Yes, yeah, but they have to have something else in there already, like eyes or a DNA test.
Right.
So the next question is there a certain number of generations of cleared parents that increase the chance that puppies will be clear? For example, in the case of the patellas.
The answer is There is no specific number, but using what is called the vertical pedigree. So if any of you have access to being online and looking at the OFA website, there's a place called vertical pedigree. You put a dog's name in there, well, put a dog's name in first, find it, and then click on vertical pedigree. You can see that dog and that dog's parents to see if that dog's parents were checked, and if the grandparents, you can go back about 4 generations, and how many of the litter mates. So I'm making this probably more complicated than but let's just say, for instance, the dog that you're interested in was one of a litter of 4. And so you go to the vertical pedigree. If it's the only one of the litter that cleared, even though that dog is normal itself, it's going to have lots of genes for bad patellas. And so that's the vertical pedigree gives you that information, which is the closest you can get for a gene test. Likewise, in large dogs with like Labradors or Goldens, if your dog is from a big litter and you can see on the vertical pedigree there were 8 puppies and 7 of them OFA, that gives you a pretty good chance that. So the more information you have on parents, grandparents, and siblings, the better you are. 2 individual dogs gives you information, but not that much.
Perfect. I also just want to say that all these questions are fantastic. We're going to try to get to as many as we can. But if your question doesn't get answered, I'm very sorry. All right. So the next one is I've seen several charts over the years comparing the different evaluation systems, OFA, BVA, FCI, etc. They have some differences. Does the OFA have a comparison chart that you can refer to?
There are comparison charts, but it is not publicly available. So I can't send you to a site to get it. What I can tell you, the biggest difference between the systems is OFA is the only system that is done at age 2. And remember, we talked early on about the 95% reliability. BVI is done, I don't want to be wrong here. One of them is done at 18 months and one is done at 12 months. So that would be like equivalent to our prelims. So not nearly as solid, guaranteeing that they're going to stay solid. So, and also, well, I can give you an example again. I have my most knowledge with the BVI system in Labradors. I can tell and because the BVI system, it's a numerical score for each hip. If the dog had the worst hips in the world, it would get a score of 100. If it had perfect hips, it would get a 0. I have imported a number of British dogs and have had friends who have imported a number of British dogs. And what we have learned is if the parents have a hip score total that is over 10, the puppies are not likely ever to get even an OFA fair. And I can tell you that 15 years ago, the top winning Labrador in the UK had a total hip score in the 50s.
Oh.
Yeah. So they share it and it's open, but it's not going to fly with our system.
So kind of a follow-up to that is, does OFA have any future plans to move away from qualitative hips to more in line with BVA or other global systems?
No.
All right. That answered that.
Because we have the scientific studies to prove the changes that you have to be 24 months to be sure.
Okay.
Yeah.
And then last question for Susan is, when it comes to LTV evaluations, what grading does the OFA use for grading levels, and how does it compare to other systems?
LTV. I'm not sure what she's talking about. What is LTV?
Susan, could you clarify LTV? We'll see if she puts in the chat. So we'll go to the next one for now.
Okay.
Oh, transitional vertebrae.
Oh, what system do we use?
Is it on the hip evaluation, the spine evaluation, or both? Did you hear that, Dr. Fran?
Oh, it's on the hip evaluation.
Okay.
And it's a noted finding. They don't comment about it really, other than that they have transitional vertebrae.
Okay, and then the next one on sorry, I'm trying to get through. I'm trying to get through on what is still phenotypically. Is moderate considered a pass?
No. Normal hips are excellent, good, and fair. Abnormals are borderline, mild, moderate, and severe. Moderate is very bad hips.
Okay, and then Jill asks, wolfhounds are known to live an average 6.3 years. Many do not test for eyes. Many say even with cataracts, the dog will never live long enough to be blind or painful. In a rare breed that dies young and has limited correct stock, should we be taking chances with eyes, specifically cataracts? This breed also gets PRA, like you stated, managed just fine. Thoughts?
I would say everything it's a whole biological system, and I feel your pain with these great, wonderful wolfhounds and their short life. Most cataracts are quiet. If a dog has quiet cataracts, it again is a non-painful condition. If a cataract becomes hypermature in any breed, it's very painful and then may require surgery. So I would say, based on what I'm hearing, if I were a wolfhound breeder, cataracts would not be a major concern to me.
All right, and then one more would be Macaulay says, I've also heard that students are evaluating OFA x-rays. While I'm all for educating vet students, I want RADs evaluated at the end of the day by the head radiologist. Feel anyone evaluating x-rays should have their names provided.
Okay. So I can answer that. No students evaluate any x-rays. There are 21 board certified radiologists. Only radiologists evaluate the films. We do hire vet students in the summer to enter data, but it is data entry. So they're typing in owners' names and stuff like that. They do not evaluate any films.
Okay, and then just a follow-up for the transitional vertebrae. Overseas are grading 1 to 4. Do you grade them or you just note it?
We just note them at this point. If there was concern from a breed club, a parent club, say the German Shepherd Club or any other club, that wanted us to do more, potentially that could happen.
Perfect. All right, so jump into genotypical, and then we have a couple DM questions for you after this slide.
All right, DM always comes up. So genotypic, we know the causative gene. We can identify it, and you can use the test to improve the situation. I want to stress again that you don't want to arbitrarily discard every dog. You always want to breed to improve. But for instance, and I'm sure that Sarah probably knows this, years and years ago, the Portuguese Water Dog Club was very concerned with PRA, right? And they did massive, I'm going to say, discarding of lots and lots of dogs. And during the process of doing that, they accidentally picked up another disease that they would have preferred not to have. Now, that could have been avoided were we, and I say we, all of us, smart enough to realize at that point, all they would have needed to do was to continue to use carrier dogs and breed to unaffected and decrease the incidence, and they wouldn't have accidentally piggybacked this new disease into the dogs that they selected for their new breeding populations. So you need to be wise in what you intend to do. And again, it's a population effect. That's the same way that EIC in the Labrador is inherited. There's thousands and thousands of other dogs that had no genes for EIC. But that doesn't mean that a dog that had a gene for EIC or in a breed that doesn't have big populations, that you wouldn't even use a dog that had 2 genes for it and breed to clears to decrease your incidence. What you're trying to do is avoid a genetic bottleneck where you pick up a stranger that's worse than what you were trying to fix.
All right, so we've got lots of DM questions.
Okay,
I know
that's
that
fine.
always comes up. Can
Yep.
you provide a reference for DM testing and how reliable testing currently is?
For where to send the test? Is that what they're asking?
I think just like how reliable is the test for
The
DM?
test is a risk assessment test. So they know the gene that DM is associated with. So the reality is that if a dog has 2 copies, now, and this does not apply to every breed, which is why it's important to know what breed you're talking about. But if it has 2 copies of the gene that would give it DM, if it lives long enough, it is likely to develop rear end paresis or paralysis of some time. But many will not. By that, long enough might be 13. And if your breed average is 10, even though it's theoretically affected, it won't have a clinical presentation. So it's not a sure thing. For instance, I believe that there's a big concern with DM and Chesapeake Bay retrievers, not from clinicians and people who see disease, among the breeders. The reality is a huge percentage of Chessies evidently have at least 1 gene for DM, but practically none of them ever have any rear end problems related to DM. So it's complex. It's a risk gene. It's
So
not diagnosis.
on that one, are all breeds affected or is it more of a breed specific test? If it's a breed specific, are there any articles to outline that data?
There are the definitive and only definitive diagnosis of DM is postmortem. So everything else is risk assessment and clinical impressions of dogs that probably do. But most of the work, really good work on DM, was done at the University of Missouri by Dr. Joan Coates, and it requires a postmortem diagnosis. So where I would use a DM test, and this might help the listeners, is if I had a German Shepherd, I have a German Shepherd, but mine is 18 months old, and he were 8 years old, and he was starting to scuff his hind feet, and I had not done a DM test, I would do one, because there are lots of other causes of scuffing your feet other than DM, including a disc disease like a dachshund could have. And so the real value there is if it looks like he has a disc, but he also has DM, as an owner, I would not be inclined to do surgery for a disc if he also has DM, whereas if he's DM clear, you do surgery on his disc and he's probably good to go another 3 or 4 years. So that's how I would use the test in that scenario.
Awesome. All right, I'll let you jump into the rest of your presentation and then we'll try to do as many of the questions we have left after our sponsor message.
Okay. Managing. So genotypic tests are tests for liability genes, what we just talked about with DM. They can be a direct gene mutation or linkage based. They are, and when you are managing these tests, all of the management is based on the mode of inheritance. The easy ones are the autosomal recessives. Complex polygenic traits are most of the heart defects, hip dysplasia, elbow dysplasia, risk factor, and variable penetrance and expressivity. So the tests are all tools. They are not a crystal ball. They're not everything. This is just an example of my granddaughter, who's now 25, with one of my bitches and her puppy demonstrating normal Labrador temperament. I would expect a Labrador female of mine to let a human she knows handle her puppies without any question. Another little blurb on support dog ownership. Be aware of your legislation and support your good dog owners. Met that same puppy at 10 weeks. He went on to become a champion. He was OFA excellent, elbows normal. He had every clearance test known to God and man. My granddaughter named him Smokey. He doesn't look very smoky to me, but that was his name. So, all right, I need to go back here. So our selection parameters are all associated with gene mutations. So you need to realize when you're selecting a dog for erect ears, that was normal. When we started wanting dogs to have floppy ears, it made them look like puppies. That was selection for floppy ears. Behavior traits, such as fear, you should know, have higher heritability than traits such as retrieving. I would be a millionaire if I could find the gene for retrieving in Labradors and make sure that all the puppies that got sold were going to be ready to do these field trials. So purebred dogs are predictable in physical traits. They are similar in behavior, temperament, size. They're often health screened. And again, remember, our crossbreds have all the diseases we do and more. So when you're breeding, you're motivated by passion for your breed. It's a combination of art and science. Typically, breeding dogs, you all know, involves loss, gains to progress made, and the breeder must be aware of selection choices on the dog as a dog. I want to bring out the importance again, when you are talking about phenotypic traits, hip dysplasia, elbow dysplasia, all of those, they are genetic. They have an environmental component. And very important to the environmental component is nutrition. And that is why I don't work for Purina, just so you know. I do not work for Purina. It is so critically important to feed a really fabulous food because we now know a lot about what is called epigenetics, and what these puppies end up being starts in the womb with what their mother is being fed, and that is epigenetics. So if you feed a food, a Purina 3020, which I feed, or one of the other Purina products of that caliber, and all life stages food, that food has been curated for the perfect environment for that developing fetus to allow it to take advantage of the genes that you have selected for, resulting in the healthiest, strongest puppy. It doesn't need supplementation. You don't need to be adding stuff to it. It's consistent, it's well produced, and it's fair. And you really hurt yourself and your dogs by using suboptimal nutrition even between litters. I mean, dogs should be fed well all the time. You don't need to do anything differently. You don't need to change calcium or phosphorus or any of these supplements you all buy. I do not supplement at all. Well, that's not quite true. My husband teases the dogs get what we call au jus on their food because I like to do it. Au jus is cheap powdered chicken bouillon. They get a teaspoon mixed in a gallon when I make food, and I pour it on top of their food. So that's their fanciness. They think it's pretty special when they get au jus. All right, but your breeders have a big responsibility in the selection choices made. This is just when you have non-erect ears. It's an attempt to make the puppy look, and brown eyes, soft brown eyes are friendly. It's probably highly controversial too, part of my career. I cropped ears. I loved ear crops. I do miss ear crops. I really do. Actually, I miss surgery. But I don't think it's wrong. I don't think people have to do it. but I think it adds a lot to the majesty of those dogs. I have this slide in here all the time for vet students because that usually gets quite a controversy talking. All right, I think we're ready for our advertisement, Sarah, and then we'll take some more questions.
All right. So, as a sponsor of today's panel, I wanted to take a moment to tell you a bit more about the Pro Plan program for breeders. We have a brand new platinum program where breeders can get rewarded for Pro Plan recommendations to new pet owners. To upgrade to a platinum, log into your Pro Club account, upload your breed specific related health testing for approximately a sample of your breeding age dogs. So, why do we ask for this? Our goal is to partner with responsible breeders who prioritize pet health and follow the best practices for humane care of dogs and cats. While health testing is just one piece of the overall picture of responsible breeding, we feel that it's a positive indicator. Next slide, please.
Oh, okay. There.
So if you're interested in trying Pro Plan, Pro Club loyalty program for breeders offers great benefits and is the #1 choice of Canadian dog breeders. We have 3 easy ways to save on Pro Plan. We have our bulk delivery where you can save up to 35% on volume orders. We have online rebates where you can earn a $20 credit on every large bag of Pro Plan or $10 on every box of Fortiflora. You just snap a picture of your receipt and upload it right into your account. Or we also have a 20% in-store discount with PetSmart where you can save instantly at the checkout. And then next slide to learn about our fabulous puppy kits. The other way.
There we go.
There we go. Our
Oh,
fabulous puppy kits
Fortiflora
here.
is great. Fortiflora is fabulous. Any dog with soft stools should get Fortiflora. That's fabulous.
Our puppy kits shown here. So every new owner in our puppy kits gets a box of Fortiflora. There is a coupon for a free small bag of Pro Plan puppy or all ages. It's a full bag, a full small bag, not a sample size. And then coupon for 3 free cans of Pro Plan puppy wet food and $10 off their next Pro Plan bag. Plus, as the breeder, you will also get a box of Fortiflora for every litter of kits that you order. All of your pet owners are eligible to get a kit as long as your account is in good standing for eligibility. So to learn more, contact us or you can sign up online at purina.ca/proclub. But if you opted in to hear from a Pro Plan breeder representative, that's me. You'll hear from me in the next couple of days, so look out for that email. And then I do have a question that I would like to address in the chat of where Pro Plan is made. So Purina's parent company is Nestle. It's an international company that has played a important role in the Canadian economy for generations. Many Nestle products are manufactured locally. We have over 3,500 Canadian employees in many different roles, like myself and the rest of our Canadian breeder team. We are long supporters of nearly 40 Canadian dog shows, specialty events, and associations across Canada. So while the Pro Plan brand products are specifically made in the US in Nestle owned and operated facility with 100,000 quality checks per day using US and Canadian suppliers and ingredients, we are an international leader in pet research. Pro Plan formulas are backed by over 500 global experts from board certified nutritionists to veterinarians to food safety experts. We conduct feeding trials on all of our dry Pro Plan formulas. Delivering high quality nutrition to Canadian dogs and cats is our top priority. So if you have any questions or concerns, please feel free to reach out to our breeder team at any time. We are always available to chat with you and answer any questions you have. So with that, we will jump back into some of these questions. And there's a couple of food ones.
Okay,
so I want to, one is Kim. She's asking, she was using 30/20 and her repro vet now says that they prefer Pro Plan puppy for the bitches. They'd used 30/20 prior. She's seeing him tomorrow for an ultrasound, so she wishes to readdress this. She'd love to know your rationale so that she can talk to her vet about this and the webinar.
So my recommendation still would be to stick with 30/20. As you know, and I don't know if all of the puppy formulas are available in Canada or not, because Sarah told me some are and some aren't. I would never feed ProPlan large breed puppy to a pregnant female because it does have some adjustments to the calcium phosphorus ratio. If you were to, for some reason, decide you wanted to feed puppy to a pregnant female, then it would need to be the small breed or toy breed puppy where they are not making any of the restrictions that there are in large breed puppy. But I would personally stick with 30-20.
Okay, there's also a question in the chat that I wanted to pull out too, because it was about what's your opinion on 30-20 versus large breed puppy? I don't know if this is for, I think it might be for just general feeding
In
a
general,
puppy.
okay. So large breed puppy has right on there for dogs 70 pounds and above. So what that tells me is the formula, which is listed on the back, is designed to not push excessive growth in a rapidly growing puppy already. Whereas the 30-20 is carefully balanced so that you don't have to worry about the excessive growth. I am not enough of a nutritionist or a scientist to tell you the exact differences, but I can tell you the 30-20, the feeding trial testing indicates that it's absolutely suitable and fine for puppies of every breed and every size.
Perfect. Christina has asked how we add a test to a breed list. I assume
Oh, okay, that's a
she's
good
meaning,
question. She
okay.
probably means for OFA or whatever. Maybe best what I should, CHIC, which is the Canine Health Information System, is a list of disease entities believed by parent clubs to be important to the breed. And it's those parent clubs who come to OFA with a list of issues that they feel are important, and then we will maintain a database. So if you have an issue in your breed that you think is important to you, you need to go to your health chairs and say, we would like to add this test as a breed requirement. So for instance, for the Labradors, the CHIC requirements are OFA hip, OFA elbow, OFA eye, the EIC test, and we also require a test for the dilute gene. But you have to be a CHIC club member or have CHIC testing. You have to have the club has to identify 3 diseases. The other thing CHIC does, they don't have to be normal results. CHIC is about sharing information. So you can have a dog that has hip dysplasia and it can have a CHIC number as long as it's right out there telling everybody that it does. It's about information sharing to help with decision making and breeding.
Perfect. So this is kind of a good follow-up for this is how do we create a breed standard of OFA tests when the breed club has no interest in creating a standard within the CHIC program?
The easiest way, having been in dogs for a very long time, is convince the top winning dog in your breed to get all the health tests done and advertise them. And pretty soon everybody comes onto the bandwagon, because if the top French, I couldn't even tell you off the top of my head what the Frenchie health requirements are. But if the top Frenchie has all of its health requirements, all of the other people who are campaigning for top Frenchie are going to want their dogs to be in there too. So the best way is peer pressure. No one can make them, but peer pressure works pretty darn well.
All right. How do you feel about breeders claiming their breeding stock is genetically clear by parentage because the dog's parents were clear for genetic issues?
Okay, that comes up a lot. You can only clear by parentage for one direct generation. So if in fact you have a dog, and we're going to say it's for PRA, and both parents were PRA clear, the tests are on file at OFA, which means all of the criteria was met, including permanent ID, that puppies of that pair could be cleared by parentage, but their offspring cannot be cleared unless they also submit a test. So the clear by parentage only goes one generation.
Perfect. All right. So the next question is on DM. I've heard the same dog was tested by 2 different labs and came back clear from one and carrier from another. Is that possible?
It is, and most of the labs, that's called discordant test results. I would ask both of those labs to rerun the test at no charge, and they should.
Perfect. All right, we have another question. I am a breeder of Pekingese for over 40 years. Ortho issues are not my concern, and any screening I have ever done in that respect has been free of any abnormalities. What I'm curious about is the lack of any genetic testing in my breed. I wonder if this is related to the popularity of our breed. Our breed clubs worldwide are very small. I think identification of issues are much a funding issue. There's a lack of available genetic testing. How would this be addressed?
Well, again, you have to go to your health committee. I know until Stephen Hamlin, who's on the board of the AKC, was on the Pekingese Club in the US, was uninterested in any type of health testing. He's worked very hard to change that idea and attitude, and I believe he's making great progress, but it is always made through the parent club health chairs.
Right. The next question about DM again. You mentioned it was it's a Weimaraner breeder. You mentioned before DM test is the risk assessment. Does the same for all DNA tests we do? My breed have some DNA tests for other diseases that are similar to DM.
The answer to that question would depend on each test. And the way it's published in the test description, it will tell you if it's a risk assessment test or not, or if it's actually they're identifying the gene.
All right, and then we've got another food question. Diane says she feeds ProPlan adult chicken shredded. Would you recommend switching prior to breeding the bitch? And what are your thoughts on folic acid on pregnant bitches?
Okay. I would switch prior to breeding the bitch, just because you want her at the ultimate peak of nutrition throughout proestrus and all the way until after the puppies are weaned. Folic acid at 5 milligrams per dog may, and I stress only may, help prevent some of the spinal cord issues, maybe have something to do with cleft palates in brachycephalics. The good thing with folic acid, it's a B vitamin. If it's in excess, it's eliminated in the urine, so you can't hurt the dog.
All right. And then we've got, can DNA testing from places like Embark be entered to the OFA database for their
Yes,
chick?
absolutely. Yep, we accept Embark tests, yes.
Perfect. Okay, so that's all the questions from the Q&A, but there's one from the chat that I think would be important to mention. Somebody said their breed is Chihuahua. They have eyes, heart, patella. If patellas are 99% genetic and my bitch is clear, but I don't have history of every dog behind her, what is the benefit to register her clearances with OFA if I have the vet certificates to show she is clear for those 3 tests?
I would say the biggest thing will be then anybody in the world can look up and say, and she's doing patellas here and putting her money where her mouth is, proving what she's done.
Perfect. Excellent. All right. Well, I want to thank you so much for your time tonight. I know I learned so much, and it's always nice to get to listen to someone as great as you speak, especially about genetic testing, which I personally think is so important. But I thought that was fantastic.
Good. I certainly enjoyed it. It was a great evening. Thank you very much.
All right. Thanks for joining, everyone.
Good night.
Good night.